Cholera is a disease that affects the weakest in society. It takes grip on both the young and the elderly. As this outbreak spreads across Yemen, it's becoming clear this war-torn country is unable to cope with another crisis. This hospital in the capital says it's receiving hundreds of new cases every day, leaving wards full of patients and their desperate relatives.
This is my daughter. She contracted the disease 5 days ago. Without the hospital staff, my daughter would have died. We ask the world to provide us with more medicine.
My mother fell ill suddenly. Anyone with symptoms should not hesitate and get medical help before it's too late. The situation in here is getting worse. The hospitals do not have any spare beds.
Outside the hospital, tents have been set up to provide extra beds. But with so many cases, people are treated where there is space. The healthcare system in Yemen is already on the brink of collapse. Half of the country's hospitals and clinics have closed, leaving places like this overwhelmed.
At the moment, we receive 2 to 4 new cases every minute. We are counting on international and regional humanitarian organizations to increase their support for Yemen. The disease is spreading very rapidly, and we treat patients all the time, but the center lacks medicine and equipment.
So why is it proving very difficult to help Yemen? Dozens of aid agencies work in the country, but some complain the work is being slowed down by both sides in the war. On top of this, access to the affected areas is also difficult. Shortage of fuel and damaged roads mean the supplies often don't reach the people in need. Awareness of the water-borne disease is growing in the capital. But in rural areas, where most of the cases occur, understanding is a problem. Over 200,000 people are now suspected of having cholera. And without outside help, aid agencies warn that figure could more than double. Faisal, Irshaid, BBC News.